This is your Daily Mix. The following segment is sponsored by
Hi there, everybody. I'm Bill Frankmore, and welcome to the Daily Mix, where today we're at High Risk Pregnancy Center, joined by Dr. Roxana Tweed. Dr. Tweed, thank you so much for joining us this morning.
Thank you for being here.
Yeah, tell us about High Risk Pregnancy Center.
So High Risk Pregnancy Center is a medical practice that focuses on the care of and treatment of high-risk pregnancies. So we take care of women and their babies who have complications related to pregnancy, and we work with other specialists to ensure that they're getting the best care possible in pregnancy. Okay,
I think a big question a lot of people have was, what constitutes a high-risk pregnancy?
So a pregnancy can be high risk for multiple reasons. Some patients come into pregnancy with pre-existing medical conditions like diabetes, lupus, high blood pressure. There can also be complications that develop during pregnancy, like bleeding related to the pregnancy and problems with the baby or the fetus.
And also, I imagine, age of the mother, correct?
Yes, age of the mother is also a very common reason that we see patients here, is associated with higher risk of complications.
Okay, we've heard a lot about ultrasounds and the importance of first trimester ultrasounds. Talk about that a little bit.
So first trimester ultrasound is important for multiple reasons. Early diagnosis can prevent many complications during pregnancy, improve outcomes for the fetus, and can also prevent complications with the mother related to, placenta and previous pregnancy complications.
Okay, and then your ultrasounds here at High Risk Pregnancy Center are a little different, a little more detailed. Explain what makes them more detailed, more different.
Our ultrasounds are performed. We're all physicians that are subspecialists in maternal fetal medicine. We spend a significant amount of additional training in ultrasound specifically. And when we've looked at studies, patients who have an ultrasound performed by a maternal fetal medicine specialist, we've been shown to detect 3 times as many abnormalities in the fetus or the pregnancy compared to community radiology or general OBGYNs.
Dr. Tweed is a doctor who deals with pregnancies, high-risk pregnancies specifically. I imagine this is so rewarding when you are giving to-be mothers the best chance of having a successful and a healthy pregnancy.
Absolutely. It's a privilege to be able to be involved in this part of somebody's life and help them bring a healthy baby into the world. And it's especially rewarding when we've had patients who maybe didn't have a great outcome with a previous pregnancy, and we're able to guide them through the pregnancy and have the best possible outcome and a healthy baby at the end of it.
Covering all the bases and looking under every rock for any thing that could be a danger.
Absolutely. We take care of mom, we take care of the fetus, and we make sure that the entire family has a good experience and a good outcome with the pregnancy.
Okay, if someone's on the fence, they're not sure if they may be a high-risk patient, what would you tell them?
We actually have a calculator on our website, so if patients want to go to our website, there is a high-risk calculator. They can put in their information, and it will help them determine whether or not they should be somebody who should be seen in our practice.
Okay, Dr. Tweed, thank you so much for joining us. And if you have any more questions about high-risk pregnancies, if you're a candidate, feel free to head to their website at hrpregnancy.com. Again, I'm Bill Frankmore with this edition of Daily Mix. We will see you very soon. Have a great rest of your day.
This segment was sponsored by
I delivered my first baby at 22 weeks, 6 days, and unfortunately he did not survive. I met a doctor from the High Risk Pregnancy Center at the hospital. She was so caring and told me not to give up hope. I promised her I would see her when I became pregnant again. She performed a procedure that prevented me from delivering prematurely again. My doctor was with me every step of the way, and she worked with my obstetrician. Thank you, High Risk Pregnancy Center, for my healthy, happy baby.